Welcome back, everyone. Thanks to everyone who was able to join the earlier panel where we launched IWPR's new research, which monetizes the cost of abortion restrictions at the state level and we put it all in a tool that will now is now live. And with the hope of having another tool that advocates can use to engage policymakers and corporate allies so that we can help to fight all of these restrictions, which I'm sure we're going to hear more about from Alexis shortly. So thank you guys for joining. Make sure you check out the tool. This next conversation is going to be moderated by IWPR's president and CEO, Dr. C. Nicole Mason. And so I will go ahead and turn it over to her.
So I'm so excited about this conversation with Alexis and Christine. I just want to hop into it. This conversation is about understanding the intersections of reproductive justice and economic justice and how we might work across movements to make change and beat back some of the restrictions that are direct impediments and threats to women's full reproductive freedom and autonomy. And we have about 25 minutes for this part of our conversation, and then we have a dynamic panel that will follow, which will delve a little bit deeper into the intersections. So I want to just jump into the conversation. Alexis, I just want to say I read over and over again your op-ed in the New York Times, which really, again, orientated us and gave us an understanding and perspective about how we do this work and what we might be thinking about as we do this work at the intersections of race, class, gender, and other markers of difference. So PPFA, we all know, is committed to providing comprehensive health care services to women across the country and has been engaged in some really critical fights in recent years. But can you talk about the link between women's reproductive health care and healthcare services and delivery of those services and women's economic security and well-being?
Yes, absolutely. So first, thank you for having me. It's such a joy to see you and to see my friend Christine as well in this conversation. And it has been quite the week. So to have community to come into means everything. And thanks for the nod to the op-ed. I think that really the framework there is about what an organization like Planned Parenthood can do to really meet patients at the intersection of their injustices, right? To make sure that, while we have patients who come to us for, STI treatment and cancer screenings and abortion and, other gender affirming care, we know that when they leave, anything could happen to them, right? ICE could show up on their job. They could be pulled over by the police. They may be experiencing a lot of other indignities related to economic, to really what the tools to actually engage in economic empowerment. And so it was just really important to be able to create a framework for us to lean into that really would affirm that. And, Planned Parenthood was built on the premise that if you control your own body, you can control your own future. And I do think that a lot of what we have been focused on from a reproductive health standpoint is what are some of the tools that we need to imagine freedom. And we know that economic security just has a direct impact on healthcare access, because if you can't access health insurance or affordable health care, people will forego the care that they need. We've seen this certainly over the last year during COVID and the impact of some of those decisions. And so, we've been, and I'm super excited about the tool as well in terms of making that connection between understanding the impact of the work that has already been done around birth control and understanding that access to birth control has actually been responsible for like a third of women's wage gains since the 1960s. So that is like absolutely critical. But this new tool from IWPR to give us data around making the economic case for abortion access in a moment where, obviously where access and the rate are very much online. It's just going to be so interesting instrumental for our fight.
Thank you. Thanks for saying that. And again, we are at this point, we need every piece of available data that we can sort of dig up to make this case, and using all the strategies that we can to, again, beat back these restrictions, especially from, what's happening even at the Supreme Court. So Christine, I just want to bring you into the conversation. You've done so much work over the years, especially your work around teen moms. And when we first met, when I came to IWPR, was very, I don't know, we just became like very quick friends. And mainly because I believe that you had a clear grasp of, again, the intersections of race, class, gender, reproductive health, autonomy, economic justice. And so can you just talk a little bit about what the lack of reproductive autonomy and agency and the economic outcomes for women over time, and like, why is it important for us to make that connection, especially in this moment?
Yeah, definitely. It's great to be here with you and Alexis. Good to see you. Yeah, so it's interesting because when I came into this role, as you mentioned, I came in most immediately from running an organization here in California, working with teen moms. And actually, Alexis, your part of your response was a really good tee up to this, which is that it really made me realize that these were young women, but this applies to all women, that there are so many factors intersecting in their lives. And so I think part of the reason why we were interested in supporting the center at IWPR is because I had seen, and I saw, continue to see it in this role at the Hewlett Foundation, that the reproductive health research tended to be somewhat siloed from kind of the real lived experiences of women. And it's not a criticism of researchers. It was just mostly based on methodologies and the data sets available. A lot of it was sort of population level data of like, let's look back when the pill was legalized and see what happened at that point. And there wasn't a lot of, and there still is not a lot of actually asking women, young women, older women, whoever they are, like, how is access to reproductive health and rights affecting your life in economic terms specifically? So, we know that women have had exponentially increased economic opportunities as they've had more access to reproductive health care, but we don't know it kind of within specific populations of people, and certainly not at a household level, how it actually impacts people over time. And in the first panel, Diana Green Foster was on, and she's, her research is so groundbreaking because it really looked at individual women and how is this affecting your life. So I think in terms of autonomy and agency, I think it's a lot of, what we see when we really dig down is in individual women's lives is that what autonomy and agency means is really different for different people. It's partly about preventing pregnancy, and it's also being able to have the children you want and raise them in the way you want. So I think that's one of the reasons why we've been excited about the center and being able to kind of look at this from many different angles.
And I just want to thank you for saying that, in terms of, like, even when I first came and I was looking at the research that was coming out of the center, I was like, well, this is interesting, but I'm not sure it's as useful as it could be. To your point about it being rooted in the lived experiences of women and how they experience their reproductive health access, and what it means for them, and being able to frame that and put that in conversation with the data allows us as movements to figure out our strategy, where we should target our efforts, and what women need specifically in this moment. So bringing me to, back to you, Alexis, and thinking about strategy. So, obviously we all know what's coming down the pipeline around the Supreme Court, the hearing, and we know that more than 500, anti-abortion restrictions, including bans, have been passed since the start of 2021. But what impact might all of these things have or have had on women's, again, reproductive autonomy and freedom and access, but also their economic, well-being and security, and being able to take care of their families and access and, affordable, healthcare?
Yeah, we are all, and I know, deeply concerned those listening here and afar about Monday's news that the Supreme Court is going to take up this 15-week ban in Mississippi, and the way in which they're taking it up is literally a challenge that goes to the very heart of Roe, which we already know is what our reproductive justice colleagues call the floor, at best. But the willingness to undo 50 years of precedent, there's always been a bright line that pre-viability politicians don't decide, that we can decide, really thinking about the impact now for what could happen to, upwards of 25 million women of reproductive age living in states where it could be banned. And you talk about the number of state restrictions and the important work that Guttmacher has done to help us track and understand not only the number of restrictions, but also constitutional amendments and the ways in which they have been amplified over the last this last state legislative cycle. And it's happening at a time when we also know that we've had record highs of support for access to abortion. So the fact that that all of this is happening against the majority of public opinion in every single state, not just national public opinion, but literally every single state, there is a majority of Americans who believe that Roe should be the law of the land. It really just highlights the kind of starkness of again, who is making these decisions, and then thinking differently about what is the impact going to be on not having that access. And we know at the national level, the state level abortion restrictions cost $105 billion per year, right, by reducing labor force participation and earnings. If all the state level abortion restrictions were eliminated, 500,000 women would enter the workforce, earning $3 billion. Some of the same states where we're seeing the most extreme restrictions have the most to gain, states like Arkansas, Missouri, Mississippi, and even California, one of the better states, both with access that is definitely much more liberal because of the size of the economy, could see $5 billion more a year in the state economy. And so I think it's really important for us to understand not just I think we have been talking about this in relationship to the additional burdens that we've seen on the restrictions and the impact on the lived experience, as Christine was talking about, when you really kind of factor that into just how horrific some of these restrictions have been. We've seen it just last year during COVID, the extreme measures that people had to do to travel, to get out of state when governors were adding these executive orders and restrictions, and we know the impact that that it will continue to have if Roe is gutted or overturned next June, and I think of participation and opportunity that is also connected to this experience.
Everything you've just said just underscores the urgency in the moment, what's at stake, what we might be able to benefit. And I've been thinking about what is it going to take for us to win? So we can hold back, we can regress, we can keep the restrictions, try to fight those back, but how do we work specifically, and what kind of coalitions do we need to really win on in big ways on reproductive health, access, abortion? What do we need to be thinking about as a movement? This is I'll say to Alexis, but also Christine.
Yeah, I mean, I think that we've never been stronger as a movement in terms of the kind of convening and organizing we've been doing inside of the reproductive rights, health, and justice space. I think that the work that we did around the Blueprint agenda, where over 100 organizations came together to start, again, to think about in addition to abortion restrictions, talking about Title X, lifting the domestic gag rule, all of these ways in which we needed to be aligned, access to telemedication abortion, right? These are things that that are critical to aligning around the economic security. I also think that the work that we've done in an intersection with other organizations like racial justice groups and immigration rights groups in terms of having those conversations around the impact of those who and centering those who are most marginalized has also been really important, so that we can lift up their stories and their experience and understanding the economic costs to their lives as they drive. I think we also need to do more on, expanding access through things like telehealth, making sure that we are pushing to expand as much access as possible in states that are favorable, so that we really are demonstrating the kind of stark disparity. We need to be pushing on things aligning with businesses around issues like broadband that limit that access to to healthcare. But I think it's ultimately part of what we have to do collectively is work together in these at these intersections, and I think keeping them stronger than coalitions which come together and disband, but really keeping an intersectional group together that takes all of this on, including democracy reform, so that we are able to make sure that we're connecting the dots between the same states that are having these horrific restrictions on access to abortion are also the same states that are suppressing the vote. They're the same states that are attacking trans rights. And that, I think, how we show up authentically in each state, because it is going to be a state by state work to really focus on state constitutions. At some point it's going to require that kind of connection and infrastructure to work together, and including the corporate sector.
And I think that's right. And I teach participatory policymaking. I'm here to say that no major win fight over the last 50 years has been won without a really broad coalition of organizations, issues, all that coming together to advance towards a big collective goal, or beating back some. And so I just want to shout you out, because the Hewlett Foundation is the core, the founding supporter of the Center on the Economics of Reproductive Health, and you have a bird's eye view of the field and what's happening, where we should be focusing our efforts. So I wanted you to speak to, if you could, what opportunities do you think we have, and what role do you think an organization or a center like ours might be able to play in supporting the movement around some of these issues that we've been talking about?
I think building on what Alexis was saying about having coalitions that are longer term, that don't just form and then disband, but really creating more of a kind of multi-issue movement. That's what I'm seeing, is that's happening more. That certainly within the repro space, it is a more cohesive movement right now. But I think one thing that is going to be really helpful, and which is part of the reason why we're funding the center, is that we need data that sort of reflects that more intersectional perspective. And it's not that nobody's been doing it. There are great organizations that have been doing research on many different things. But for example, IWPR, before we started funding you, it was the fact that there was work on, student parents and, college student parents, and what are their needs, and then how do we start connecting that to reproductive health? There were, paid leave, all of these different issues that you were working on. You're positioned to then kind of directly connect that to reproductive health, both care and rights, and use that for advocacy purposes. And so I think it's sort of feeding into, I think, both the evolution of the reproductive health rights and justice movement is sort of synchronized with the direction that the center is going, and it's grounded, it's sort of founding principles around really drawing these intersections. And so I think that the kind of research that's coming out of the center and will continue to come out of the center will be very, very useful for the movement, and it'll be sort of a synergistic relationship, which I think is really helpful.
Yeah, and that's what we're really hoping to do. And again, you know, really doing the research and knowledge building in partnership with the field so that we make sure that what we're producing is useful and can be leveraged for the field to make the case. And that's the most exciting part about it for me, at least as a researcher who also is interested in movement building. So we have about 10 minutes left. So I do have a couple more questions, but definitely want to open it up to the audience for any questions that they might have.
You know, while you do that, Nicole, I just wanted to add in on building on Christine's point about the way all these intersections are happening. You know, the power of, you know, the Institute to also speak to businesses, right? When you think about like the way businesses showed up in Georgia around voter suppression just recently. I mean, like, you know, that's an untapped resource that, you know, a lot of us, particularly around access, you know, to sexual and reproductive health, you know, like having these conversations from a talking about business, I'm thinking businesses for birth control, talking about birth control, but also talking about stances on abortion and other areas. We'll be pushing the boundaries and having access to data to help us make that case, and also give them and their employees an opportunity to organize internally to think about how a company lives their values, which we know is so important for the next generation, right? To really want to work for a company that is very consistent with their values on everything from race to the environment, and now voting and politics. I think it's becoming really, really important that your work is that glue that helps us do that.
Yeah, and thinking about, so we have the research, thank you, Alexis. So we have the research on this on the one end, but then, you know, to your point, your earlier point, Christine, like there's a lot of silos, you know, people doing their work, you know, the reproductive justice work, the reproductive, economic justice work, reproductive justice work, immigration work, but not having the same conversations and realizing that, again, all of these issues are very connected. What might we be able to do to help facilitate those connections in real and authentic ways? Because again, we're all busy doing our work. And so how do we do that? And I know, Alexis, you mentioned the coalition of organizations doing the work. But can either of you talk about that? And, you know, in your work, Christine, I know that you very much try to make those connections.
One thing I've noticed, and I think both of you, Alexis and Nicole, are representative of this, is that I think the people, this is going to sound so trite, but it really is about the people and the people that are in these positions to make the connections. So, you know, I mean, Nicole, you've been there for a few years and it was different leadership before you got there. And we were certainly in communication and we had funded the center before you got there, but it's a very different sort of way of working now, at least from, you know, my perch, what I can see, and just who you're reaching out to, who you're connecting with, who you're bringing to the table, you know, just in your mind, there's a generational difference, you know, it's just a different, like who is in these roles really matters, you know, and Alexis, that's obviously true for you too. You come in with a really, you know, a very important lens on the reproductive health rights and justice movement, but also like you can situate that in a much bigger or kind of different perspective than some of your predecessors have had. So it sounds simplistic, but I do think that the people in these positions really matter. You know, whoever's making these connections does matter, and I think it starts there. And it's amazing how quickly we can start to see changes in sort of what the network map is in these conversations.
Yeah, and it seems it is about the people and the leadership and the framework and, you know, doing the deep work to make the connections. There's a question, and, you know, Alexis, I'll let you answer the question as well, but if you want, but there's a question about how do organizations balance the bandwidth bandwidth they have and the desire to participate in authentically in broader movements and really engaging in interdisciplinary cross-movement work, you know, which I always take this question to be the red herring for why we can't do intersectionality, but I'll just say that. you know, my short answer is to just do it. Like, we got to make the space to to do it and reconfigure ourselves to be able to do this work authentically. But that is my opinion. Alexis, Christine, might you have an idea about this?
I was going to say, Alexis, I would be curious to hear your answer to this, because Planned Parenthood obviously is pulled in a lot of directions and it's at the center of a lot of work. So I think it would be really interesting. And from what I can see, you are sort of evolving it to be more connected to different movements and different issues. So I would love to hear your take on this.
Yeah, and I thank you. I honestly, I think Nicole's answer is exactly what I would have said, right? You just do it because we can do hard things in that way. I also think that for us, it has been a deliberate shift. I think for us, the red herring is often, is it mission creep, right? Because you are taking a stand on this, or you are using your muscle for this, or you are now talking about democracy reform, and what does that have to do with abortion? And what, you know, and I think that so much of the work is actually connecting those dots to say, and for at Planned Parenthood, what's help as a healthcare provider, right? We first and foremost a healthcare provider. What is helpful in that is to be able to look at all of the work through the lens of the patient, and to challenge ourselves internally to make sure we are doing the right work, to make sure that patient experience is seamless, and where we're creating the right experience of belonging, and then make sure that as an organizationally, we are also showing up in the world and in the movement in ways. And it's, you know, it's hard, you know, to take on these pieces, and not hard in like a trite way, but like it is, it's a very complex organization and a federation that, you know, it's like a big steamer ship, you know, it doesn't turn on a dime. It doesn't turn, you know, it's like really trying to understand blind spots, I think, has been a lot of the work. But I think that's the bet, you know, that I hope that I'm making, leadership team is making, along with many leaders in the in this space, is that the more that we are able to do this work, the more we are able to think about how we, you know, are, you know, not always out front leading, but like thinking about our muscle and how we can use it to support leadership. That's also a way that I think we grow the work at the intersection, so that it's really clear that, you know, we understand what our you know, future freedom looks like, but how we think about it more systematically and thoughtfully about how we show up in the movement is important too.
So we have like 2 minutes. But I always like to leave on a positive note in these kind of conversations, because this stuff can be really heavy. These conversations can be really heavy. So I like to ask each of you about, like, what are you hopeful about in this moment? And you know, what you'd like to see, but mostly what are you hopeful about? Who wants to go first?
It's hard. I'm hopeful. I'm just hopeful by the transformation of leadership in this space. You know, it just is really energizing, the conversations, the privilege of sitting in just some extraordinary, you know, thought leadership, high level thinking around, you know, what can be done, what should we do, and how we should do it, and how we can build structures of accountability with each other. That really gives me hope, because it feels like a kind of a new grounding, and something I haven't seen, having, you know, been related to adjacent to the movement in various ways for the last decade. And so I am kind of energized by the conversations that are happening right now that are building trust, to, you know, Christine's point around how you actually really build relationship.
Yeah, I would second that. And I think along with that, there's a willingness, I think, to try new things. There's less fear of kind of throwing things at the wall and seeing what sticks. I think there used to be a lot of fear, and there was a lot of sort of desire to control everything, you know, everything that we were doing. I think one example of that is there's a lot more momentum now around doing culture change and narrative shift work, where people were doing it before, but it's like coming to the forefront more than it has in the past. So I think there is definitely reason to be optimistic. There is a lot of new, exciting people and new thinking going on.
I can say, and I'll just end on this, I am very hopeful that we're going to win, and we're going to win big. And I'm hopeful. At 20 years ago, again, I when I started doing this work, the leadership looked completely different. And, we've done the work, and we're doing the work. And so I just know that this is our moment, or it feels like it at least. Thank you, Christine and Alexis, for joining us. This is the end of our conversation, and I'm going to turn it back over to Michelle, who will introduce our next panel.